So before approaching my patient, I'll just confirm that the scene's safe. There's no slips, trips and fall hazards, so I'm happy to enter. Layla, are you okay? Layla? There's no response, so I'm going to pull the emergency buzzer and shout for help. Help. Hi, are you my help?
Yes.
Would you be able to put out the crash call at 2222 and let them know we have a paediatric cardiac arrest on ward 1A in the RVI? When you come back, would you be able to bring me the resus trolley, emergency drugs, and can you bring me a bag valve mask connected to 15 litres of oxygen, please?
Okay, I will do that.
Thank you. So I'm going to ensure that the patient's on their back and put the head in a sniffing position using a head tilt, looking for any visual obstructions, and I can't see any. So now I'm going to look for chest rise, listen for breath sounds, and feel for air on my cheek for no longer than 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. There are no signs of life, so I'm going to give 5 rescue breaths. So for my rescue breaths, I'm going to place the mask over the patient's nose and mouth, ensuring there's a seal, put the head in the sniffing position and give 5 breaths steadily over 1 second. 1, 2, 3, 4, 5. There are still no signs of life, so I'm going to commence CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And 2 breaths with the head in a sniffing position. 1, 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And 2 breaths with the head in the sniffing position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And 2 breaths with the head in the sniffing position. And continue until my help arrives. Hello, I'm Steph, one of the staff nurses on ward 1A. Are you the person I'm handing over to?
Yes.
Could I just ask your name and designation, please?
Yes, my name is Andorado. I'm part of the research team.
Okay, so like I said, my name's Steph. I'm one of the staff nurses working on ward 1A in the RVI. Is this a good time to hand over the patient?
Yes, it is.
So this is Layla Lily. She's a 5-year-old child who was admitted to ward 1A yesterday with a history of continuous cough, fever and intermittent oxygen desaturation. During morning rounds, her mum shouted outside of the cubicle that she wasn't breathing, and when I went in to check, she was unresponsive. So I started by giving her 5 rescue breaths. They were successful, however, there were still no signs of life, so I continued with CPR at a ratio of 15 to 2. During my compressions, I used the heel of my hand on the lower half of her sternum, making sure I didn't put any pressure on her ribs, and performed compressions at a depth of 1/3 of the chest, which is around 5 centimetres, at a rate of 100 to 120 compressions per minute, ensuring I let the chest recoil fully after each compression. I gave 3 cycles in total, so that was 45 compressions and 6 breaths, and there were still no signs of life, but the help arrived to continue CPR. So my recommendations would be to transfer Layla to intensive care for closer monitoring and further investigations, continue CPR and defibrillate if necessary, and ensure that she has a line so emergency drugs can be given. I'll complete the post-resuscitation documentation and I'll update her next of kin. Do you have any questions for me?
Yes, Steph, what would you do if nobody comes to help you?
As Layla is a child, I would do 1 minute of CPR, and if help still hadn't arrived, I would go and get help after that 1 minute. If Layla had been an infant, I would have taken her with me while summoning help and performing CPR to minimise any interruptions. Any other questions?
No, that's okay.
Okay, so like I said, my name's Steph and I work on ward 1A. If you do have any questions, you can just give me a call. And I'll just end my station with hand hygiene.